If you put implants on top of the muscle, then your chest looks like this. There's a flat area up here, and then the implant starts. And this is not a particularly good look. When you go underneath the muscle, because the muscle originates on the bone of the arm, but inserts on the clavicle or collarbone, and therefore when you go underneath it, you're putting an implant just exactly where you want it, so the fullness doesn't start where the implant starts. It starts above where the muscle starts, up towards the collarbone. Implants through the armpit underneath the muscle look better, and I do this endoscopically, so when you're looking into a TV monitor, you can see exactly what you want to do. You take the muscle off the fifth rib, and you stop any bleeders with an electric cautery. So to recap, I believe in silicone implants through the armpit, underneath the muscle, that are smooth and round. And I feel very comfortable with this. I would be happy to discuss this with any patient and explain my theories and why I feel comfortable with it. Again, I think as a patient, I would prefer a doctor with an opinion. I don't want somebody that says whatever you want. I want somebody that knows what they're doing, explains it to me well, and then I can accept it or not accept it, but I at least know where they're coming from. Now that we've decided, or maybe we haven't, but I have, now that I've decided that I like round implants, there are 3 varieties, and the 2 manufacturers, Allergan and Mentor, make a very wide implant called the moderate that is not useful except in very large women. The intermediate, or it's called the moderate plus, is useful for the small woman who wants a small implant, but would also like to get some cleavage. It gives you more base diameter, more direction this way, and for any particular volume. So I like the moderate plus profile specifically for that situation. My favorite implant is the high profile. It's got a narrower base, more projection. It will lift up some of the droopiness in breast because of the more projection. And if you get any kind of size implants, not real small, but intermediate size, the base diameter is sufficient to give you cleavage. And finally comes the question of size, A, B, C, D. Unfortunately, there is absolutely no standardization in the bra community. So if you're a B and you go into Victoria's Secrets, you're a C. Now, who's to say Macy's is right and Victoria's Secrets is wrong? But people don't understand when they wanted a C cup and they go to a store and now they're a D. Does that mean that the doctor didn't make them a C? No, it doesn't. It means that bra manufacturers do not agree on lettering. Therefore, it's better to be sure that you like the size before you leave the doctor's office and before surgery, as opposed to worrying about a letter one way or another. So that is the alpha and the omega of decision making for the patient. Overall, I believe that the optimal breast augmentation is using one of the 2 basic manufacturers, only American implants. Implants that are made in foreign countries are not legal in the United States, and they are definitely not trustworthy. I like round, smooth silicone implants through the armpit, underneath the muscle, and I do this with an endoscope. Whatever size the patient decides on, A, B, C, or D, it's more important to pick the number, how many grams, or how many grams specifically match what you would like to see. So in our office, we have an array of implants and then we put them in a bra. We have very specific blouses that we put on, and with a tight-fitting blouse, you can look in the mirror and decide if that volume matches what you want. And it may not be a B or a C or a D. It may be different numbers or different letters depending on what store you go to, but it matches what you're looking for. Breast aug surgery takes approximately, it's straightforward breast aug, takes approximately 2.5 hours. I'm not a fast surgeon, I'm an accurate surgeon. I have friends in the mainland that can do a breast aug in 30 minutes. I worry about the consistent quality of breast aug done that fast. My patients never ask how fast I did it, they just ask how well I did it. The surgery takes 2.5 hours. We put drains in everybody. Drain is a silastic tube inside the breast pocket that comes out through the armpit, comes to a little bulb, and normally it comes out the next day. And the reason for the drain is, number one, you can tell if there's any excessive bleeding. That never happens, luckily. But number two, it gets the blood out from around the implant. Blood around the implant leads to hard breasts, and you can write that down and take it to the bank. You do not want blood around the implant. Now, since I operate endoscopically and we can see the bleeders, we can stop them, but there's always oozing from capillaries, and that you need to get out, and that's why we put a drain in. We normally take it out the next day, but we leave it in longer if there's more drainage than that makes us happy. At the end of surgery, I also put an ACE wrap on, and the ACE wrap is to push the implants down into the bottom of the breast. Implants tend to ride up, whether the incision's in the armpit, at the nipple, or at the inframammary fold, and when implants ride up that are underneath the muscle, they don't come down. Now, if it's on top of the muscle, it's different, but I don't believe on top of the muscle. I don't like the looks. The ACE wrap, we take it off, put it back on, but it stays on for 10 days. The drain normally comes out the next day. At the end of 1 week, you can go on long walks. At the end of 2 weeks, you can go swimming. At the end of 3 weeks, you're back in the gym. And at the end of 4 weeks, you can go running. So at the end of 4 weeks, your breasts look good, they feel good, and you own them psychologically. It takes about a month to grow into them, and then it becomes not something that the doctor did to you, but actually becomes you. The next question after you've decided to get breast implants, what could go wrong? Now, there's only a very few things that could go wrong with breast implants. Number one, you can get an infection. Infections are so rare, thank goodness. And if you get an infection, the implant has to come out. You have to be treated with antibiotics, and a new implant goes in about 3 months afterwards. And also in my practice, this is very important. Who pays for this redo? Number one, I buy insurance on all my patients, and so if a problem occurs in the first 30 days, the insurance company takes care of it. Number two, my deal with all my patients is if anything goes wrong in the first year, I will take responsibility. I pay for the surgery, I pay for new implants if necessary, I pay for the bra, and even the lab work. So if anything goes wrong, it's taken care of.